see we're going to be going over some x-ray results today and possibly looking a little bit closer, doing a bit of treatment. Is that correct? Excellent. You'll have to excuse me, I just got over a cold. My voice, I'd rather not speak with a upper tone of voice because it hurts my throat. You might see me differentiate in between our appointment today, but for now I'm going to focus on intense whispering for my healing and possibly for your relaxation. Why don't we start and go over a little bit of information? Just a little bit. Just a little bit. Is that okay? Good. Can you just recite your birth date for me? Okay. Any update, changes to medications from last time? So, for the one situation, have we upped your medication for that, or are you happy on this dose? No side effects? Everything? Has the antibiotic been a good dose, do you feel? I always like to ask patients about side effects, things that could potentially be just, interfering with daily life. Okay. That's wonderful. I'm really happy this treatment is working for you. We'll continue down this path, and I will go ahead and start the examination. So before we go over the results, I'm just going to come in and get your heart rate. Yes, the nurse usually uses the blood pressure monitor cuff. Everything's electronic nowadays, but I still like to do things pretty classic. Yeah. Okay, do you mind if I touch? If I come in and touch you? Thank you. Some patients get a little bit of anxiety. I like to make sure we establish a nice and comfortable relationship prior to treatment. I understand this can be a very personal experience. Okay, can you take a deep breath in for me? I'm going to go ahead and place my hand here on your shoulder. Deep breath. In through your nose. Hold. Out through your mouth. Good, good. So I'm going to do that again, but when you exhale, do you mind if you go breathe in through your nose? And I want you to purse your lips on your way out. This is so I can hear your lungs. Oh, this. It's about time for a new Lidman, dear. That's rust. In through your nose. And purse. Good. We're checking for, again, any fluid in the lungs. We're checking for your heart rate, how it goes as you breathe in and breathe out. We're looking for tachycardia, which is elevated heart rate, SVT or AFib. So, if you had any of those, we would treat them promptly, and it pretty much ceases the need for an EKG today. Okay, I'm going to go ahead and get your blood pressure. I don't think the nurse did that prior, did she? Good. That's really good to know. Okay. Oh, this needs to change. All of this, again, just because I like to do things the classic way doesn't mean that they're the right tools for this day and age. Okay. just want you to focus on your breathing, okay? Alright, just gonna go ahead and take your right arm here and go ahead and wrap this on here. Is that tight enough for you? Good, good. Alright. I'm just going to start. Good. Alright, we're just going to go ahead. Okay, go ahead and pull that out. Wonderful, dear. I'm just going to go ahead and put this over here. Okay, so let's go in with the chart and compare those results. So from last time, it actually looks like your blood pressure is much more clear, obviously. And again, because of the situation, we would expect to have a faster heart rate, again, that tachycardia, higher blood pressure, and with the treatment and the medication could possibly be causing low blood pressure, hence me asking for the potential symptoms you might be having, okay? Alright, so I'm just going to go ahead and get your chart out. We'll take a look at these x-rays and then we'll possibly go over some direct treatments. I'm just going to go ahead and spray my hands a little bit before applying gloves even. I want to make sure everything is clean when getting up close and touching you. Okay, so alright, my dear, I'm just going to take some gloves here. We won't have these on long, even during treatment. But we don't want to finger up the x-rays, so. So, what's your pain level today? Scale from 1 to 10, 1 being the most comfortable, 10 being the worst. What do you think? Okay, we can treat whatever is needed. So I did want to go over a few different things today with you. Here's your chart. I have your x-rays. I'm going to go in and turn on the x-ray machine. Get the light all situated here. And that's going to be able to make viewing these photos much easier since we don't have a screen. Okay, dear? I'm just going to go ahead and back up there. Okay. We did have some findings with your situation, and I don't want to scare you because everything can be started treatment and you're obviously healing. All your vitals are excellent. Okay. I'm just going to start out with x-ray number 1. This may be just a little bit hard to see, but if we hold it up into the lamp, you can see that the tip of the finger has been broken. Let me go ahead and get the LED scanner out to show you a better peek of what's going on, okay? I have my little scanner here. I'm just going to pinpoint right here, right up here in the scan. There it is, right there. So you can tell that it was injured in the accident. We want to be looking at all the joints in the bones. We want to be looking at, as we scan, almost like a shoop, 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 looking at the entire screen here. So that's what we want to be aware of. So that's your first result. Okay, hon, we're going to go back in. And so going through the second one on this body part. Okay, so this one's going to be a lot easier to see. We actually might not need the machine. So yeah, I'm going to go ahead and turn that machine off. Okay, dear. Okay, that'll make it much easier. Right. Alright, so on this one, we can see this part right here, this bone. No, it does not, and I understand that's probably where we started treatment there, and we're going to be going ahead and doing new treatment. What's working now is working. However, we like to see a little bit more progression in your healing today. So I'm going to go ahead and treat this area right here with my device. You'll notice this is glitching out a little bit. It's pretty much AI integrated, which means that it intentionally only scans and then flickers when needed. So that's your second result. Why don't we get a little bit up close just to show you details of this part right here. And this part, we're just checking that. Absolutely, I completely understand your concerns, and that's why we're doing our best to treat. So up here, especially in that part, we want to be focusing on the full intact body here. In the accident, again, it did manage to damage that area. So just putting that aside, we're going to go ahead and scan the next part. We have 2 more areas to show you. This one's going to be a little bit hard to look at. I understand seeing some of these can revisit the situation, and ain't nobody want that. Nobody want it. So just bringing that in. I know, very, very difficult, but it's nice to look at. It's nice to take a check and peek at how much, despite the damage that's taken place, how much healing has taken place, how much time has taken place. So this part right here, we really are enjoying seeing the progression of healing. We are on a great track for this one. If you look up close, you can see the debris. The debris. The debris is just, I get it. It's a lot, but we've worked our way everywhere. We need to work to get this starting to feel better and back intact, okay? Yes, you're doing wonderful with these. So the next one I'm going to show you is the one we're probably going to be working on most today, and that's the head and the back of the spine. So unfortunately, because of this situation, I'm going to show you this part. We can see some degeneration of the back of the spine, and right down here is your tailbone and your spine going upwards. The cushioning in between here, it looks very supple here. We want to see that. We want to see bouncy, just bouncy filling, if you will. We don't want to see an empty space. We want to make sure that we're looking well. However, down here at your tailbone, you can see a little bit of degeneration, which at your age, that's perfectly normal. So, just scanning down, just scanning down. Some other situations, because of the head is pushed down in this area, and then going up through, we're looking at, T3 to T4. Certain discs are bulging because of this situation, and I just want to let you know that all of this can be managed with pain management freak out, anything of the nature, anything of the sort. All of this, except for the one that we're going to be treating today, is on a path of progression, and that's what we want to see. Okay, dear. So there was that one. I'm going to keep the little film on the back. If we turned on the machine, we would be seeing different. We can take a look just to be certain, because I understand this could be very difficult. So turning on our x-ray machine again. Okay. So going in, you can see it's a little bit more difficult. However, it also does show the main spine, the main vertebrae that I want to show you. I'm going to go ahead and turn on that scanner just a point so you can see directly what I'm looking at is the same. So all of these 4, 5, 6, 7, 8, 9, 10 are all damaged, but it's okay because again, you are on a path to healing, dear, okay? Good, okay, good. I just don't want you to be, nervous, things that I know can be difficult. That's why I'm spending all of this time with you. And last but not least in our folder, dear, is the skull and where we worked on everything during this situation. I don't like using accident as a means of describing. So before we get into our quick treatments, I'm just going to show you where we worked on that and let you know there's been no progression. However, with the antibiotic, with the spine that I showed, your neck is also showing signs of degenerative disc disease, osteoarthritis of the spine, potential early onset of scoliosis. Again, physical therapy, pain management, exercise, and a healthy diet can stop that progression. Right now, I understand we're worried about healing, so all of those changes can be a lot. But going in up here especially, I want to ask, have your headaches been any different? Okay. And going up, we can see there's no swelling, no blood that shouldn't be on the brain, especially from the accident in between the skull and the scalp. The scalp is the most important part to worry about. Make sure you're pressing every once in a while, not by the incision, but by the area, just to make absolutely certain there's no puffiness, no pain that hasn't already been there since the surgery or the treatment, and letting you know that we're on a course for healing. Okay, dear? Alright, well, now that we've done that, I'm just going to go ahead and run some basic tests, look at some things, and we'll get you out of here, okay? Alright, I'm just going to go ahead and take these. Get them all back. You're really doing wonderful with all of this. I understand that things can be pretty difficult, and that's completely normal. I'm going to go ahead and take off this glove. That way we can work on certain things. One of those things being, I'm just going to go ahead and do a little vision test, okay? So I'm going to come in with a light. This is just a very simplistic, tiny cranial nerve examination, if you will. And I'm just going to kind of do a little bit of grabbing of your arms and legs and just having you push against me, push away from me. And then I'm going to do a short treatment on your head. So, bright light here. I'm just going to have you look directly right here. Go ahead, look right here at my nose. Good. Directly at my nose. Look right here. Look right here. Okay. Go ahead and look directly at my nose. Look directly at my nose. Right here. Can you look to your right for me? There we go. I know, bright light. Can you look to your left for me? Excellent. Very good. Very proud. You're doing wonderful. You're doing excellent. Can you go ahead and look up for me? Keep looking up. Okay. And over here, can you go ahead and look up for me? Look up for me. Can you go ahead and look down? Go ahead and again look down. Okay. Just peeling down the lid. Go ahead and look down. Go ahead and look down. Good. Okay, so just making sure everything is double certain. I have another chart here. I'm going to go ahead and just do a quick color test of the eyes, okay? And we're going to test some movement. I'm just going to show you some colors very quickly. Can you read this number here? Right here. Very good. What about this? Can you read this number? Excellent. All right. Can you go ahead and read this number for me? Right here. Just a little direction. A little bit of time to find out the number is very normal. This might be because, again, with the treatment we did, with where the incision is, we want to make sure that everything is healing properly. Here's an easy one for you. An upside down 8, correct? It's almost like on Sesame Street, where Ernie is, you want to buy an 8. Shh. Okay, we're going to do this one. Can you tell me what this number is? That's right, that's why I flipped it. Alright, so I think you've done very well with the test. A little bit of time to figure out, and that's completely normal with what you're going through, which moves us into the next test. I'm going to go ahead and remove this for now. We'll save the grasping at the end. Right, so right here I have what's called a busy board. This busy board is for those who are neurodivergent, people who have difficulty concentrating, ADHD, those on the spectrum, of course, and this also helps healing from trauma. So this helps with color testing, it helps focusing, and we're just going to go ahead and I'm going to have you let me know what color lights up when it does. Okay, so just want to have you look right here for now. Just look right here at my nose, okay? Kind of focusing your field of vision as we do this and practice this. So look right here. Good, very good. And one more time. Excellent. I want you to tell me what color. This is going to be a difficult one. Very good. That's it. Okay. I'm going to have you tell me what color lights up. Very good. It might be a little bit hazy. I understand that. Can you go ahead and tell me what color lights up? Very good. Very bright. Absolutely. Can you go ahead and tell me what color lights up? That's right. And what color lights up here? You can't see. Very good. It's because it's clear. Amazing. White. And one more time. Mm-hmm. Look right here. Can you tell me what color goes off? Very good. What color goes on again? Wonderful. What about this one? Very good. Okay, what color went off there? Green. Beautiful. What color's going off now? Beautiful. And what color just went off? Amazing. You did that one absolutely excellent. I don't doubt your abilities at all. So now I'm going to go in and we're going to do a quick treatment. When I was using the little blue treatment earlier to show you the x-rays, we're actually going to be using it in the treatment, but I'm going to go ahead and just check your pupils real quick. This isn't the same as when I pulled them down. I'm going to go ahead and do a little treatment on your head. What this is going to do is prevent swelling from happening again because of the incision. So I just want you to again look directly at my nose. Just go ahead. Seeing how your eyes dilate. Good. Keep looking right here. And keep looking right here. Okay. So I have this device. I'm going to go ahead and bring it in. Make sure that it's plugged up. I'm just going to be going on and we're just going to be doing the sides of your head. And I'm going to be using the blue light and it's going to go ahead and scan. It's going to go ahead and scan and do a scan. Okay, we're going to do a scan. Alright, and this blue light is going to promote healing, reduce swelling, and so on. So just go ahead and focus, alright? So this is the blue light. Then we're going to be coming in with the white light. Okay. Again. And then just pulling around to the very top. Okay, we're going to come in and ready? It's kind of like the aura. Kind of like the aura. Excellent. Alright, so just taking that out and coming back in with the bright light. Okay, so just kind of putting that up. Here it comes, promoting healing, promoting healing. Good. Gonna see me moving this, going back down under, coming back up. Good, and again. Excellent. And one more time. And up here. focusing in on the back of the skull. Back of the skull. Excellent. All right. So now that that treatment is done, I'm going to go ahead and put these gloves back on. I'm just going to go ahead and I want to check something right at the base of your neck. So just coming in and good, very good. Just feeling for any more degeneration. Massaging your shoulders here. Alright, what I'm gonna do is I'm just gonna have you place your hands against mine and push, okay? Go ahead and place your hands against mine. Push. I want you to try to lift your shoulders as hard as you can, like that. Ready? Lift. Good. Alright, I'm gonna take your forearm here. I want you to squeeze my fingers as hard as you can. Squeeze them tight. Squeeze them tight. Okay. I want you to push my hands down. Down. Now try to push them up. Up. Very good. I'm going to put my hand up against your forehead. I want you to push against it as hard as you can. Push against it. I'm reaching my hand behind you. Push behind. Very good. I'm going to go ahead and put my hands on your legs like this, and I want you to lift them up. Good. Alright, I'm going to put my hands under your legs, and I want you to push them down, okay? Push them down. Push them down. Alright, dear. So I'm just going to go real quick behind your ankles and just take a peek. Go ahead and push against. Go ahead and push against. That's amazing. Alright, so you are again on a perfect path to your recovery today. I'm actually extremely proud with how this turned out. I will be going on and documenting this. It's going to take me a while, so you can go ahead and see yourself out. I do want you to call if you notice any new symptoms such as headache, pain behind the eyes that won't go away with a Tylenol over the counter. I want you to let me know if you notice any swelling, especially in the leg area. If you're having trouble breathing, I want you to call emergency right away. And your blood pressure was good, your heart rate was good, and it was so nice seeing you today. I will schedule for another treatment very soon, and we'll work on getting some new x-rays then, alright? Alright, we'll see you then. Have a great night.